Today we'll discuss the drugs guidelines, that is the breastfeeding and drugs. Basically, what are the drugs that can be used during breastfeeding? It is not contraindicated. So the key content here is the most commonly used medications such as paracetamols and most antibiotics in LR are considered safe to women during the lactations. And most of the drugs during breastfeeding usually express in small volume in the breast milk, so they are and the other thing that there is no direct evidence, but some medication like decongestion, pseudoephedrine and phenylephrine, and high dose diuretics and the combined ocipils may inadvertently adversely affect the maternal milk supply. Okay, so common drugs that usually used during the lactation period. Basically, everybody is know the woman in pain in the post delivery, so we have to do man management. So, what are the preferred commonly used medication during lactation? Typically, drugs that are used during the lactation phase is your type of drugs that use, that is your analgesic. Okay, analgesic. In the analgesic group, what are the drugs that can be preferred during the postpartum period? Okay, so basically, the analgesic is the preferred drug is paracetamol, ibuprofen, dihydrocodeine. That is very safe, and sometimes codeine phosphate that should avoid. In the antibiotic group, you should can give coamoxicilla, fluocloxacillin, metronidazole, and ciprofloxacin in short-term use only. And but you have to avoid nitrofuran in the first 8 days of the because in the less than 8 days or in the first those baby with G6PD deficiency, in that will cause hemolytic anemia. So that cases or baby with less than 8 days, you should avoid this antibiotic, that is the nitrofurantoins. Then next is your in the antidepressant group, because so many postpartum blue and postpartum syndromes in the delivery, you have to give sertralins. And in the antihypertensive drugs, the basically the drugs that aspirin can be used, enalaprine, nifedipine, and other calcium channel blockers, and levotiol and beta blockers such as atenolol. Okay, the contraindications: AC inhibitor other than you can give enalapril, any other AC inhibitor you should avoid, diuretics you should avoid, angiotensin receptor blockers you should avoid. And the drugs used for the inflammatory disorder like your rheumatoid arthritis, you can give prednisolone. Autoimmune SLE syndromes, up to 40 mg per daily, you can give monoclonal antibodies prefer in the postpartum period. Anti-epileptic drugs, most anti-epileptic drugs are not considered to not be harmful, but that are limited. Basically, you should avoid phenobarbital and primidone in the cousins. In the contraceptive group, progestin only pill you can give, contraceptive injection, IUD, intrauterine device, and combined oral contraceptive pills should be start. Very very important. The starting is should be 6 weeks postpartum. You can give contraceptive patch also. In the analgesic, the key message you have to everybody has to know: the paracetamols and the ibuprofen is considered very very safe and recommended as a preferred analgesic for breastfeeding mothers. That is no effect on the lactations. And variation in maternal metabolism or codeine is very very important. The codeine sulfate should avoid it because it is very unpredictable, so it should not be recommended. But dihydrocodeine, it is a form of codeine, is very safe to prescribe in short term durations. Okay, so basically, if you see the role of ibuprofen, it should give you orally. The effect, the drug level in the breast milk in the infant is usually undetectable in the breast. The approximately 0.06% breast milk, approximately at the typical infant dose. Then the paracetamol is very very safe drugs. You can give the, it is very less in that blood concentration. Codeine should be avoided because it is metabolized to morphine and the norcodeines and the codeine 6-glucuronides and via 6 cytochrome P450. Okay, the next is your plasma clearance of morphine is prolonged because the codeine is metabolized to morphine. So morphine is very prolonged in newborn infants compared to the older infant and children's. That is morphine codeine is higher in infant serum, so that should be avoided. So codeine is basically has a associated with the asymptomatic bradycardia, apnea, and cyanosis in the infants. And the exposed to codeine infant has frequency of drowsiness is very very high, that is 16.7% compared with those with paracetamol alone. So these are the things you have to remember during your so codeine, basically avoid all the morphine opioid drugs. You can give dihydrocodeine because it is unlike codeine, it has an analgesic property that has been, the metabolism is slightly different. So the medicine informations, this has to be it will be rapid metabolize a derivative of the dihydromorphins. Okay, another things, the aspirin is a derivative metabolized to salicylic acid, which is readily excreted in the disk of a high level, but it can be easily associated with aspirin infant viral infection. But there is reported that the it is some reactions has been reported, but it is not that much it is only small amount known to be detectable in breast milk, so it can be given. Okay, tramadol also is a central acting structurally to codeine and morphine, and drug level is very low, and even lower amount it's actively detected. So the effect as with codeine and tramadol can increase cerebral in a mother who has stable lactation, it is not affect. Okay, then these are the morphine should be avoided. Then antibiotic may co-amoxicillin the women with and then again the antibiotic measures. The tetracyclines are the very safe in short course while breastfeeding, although longer durations of use like for acne treatment should be avoided whenever possible. So tetracycline can be given for short course you can give. Then trimethoprim, sulfamethoxazole are preferable. Trimethoprim or nitrofurantoin are preferable to ciprofloxacin for routine UTI infections, but nitrofurantoin should be avoided in the first 8 days of life. Okay. The next thing is the on occasion alter gastrointestinal flora in infants that will cause resulting diarrhea. Throws has been reported if you use penicillin antibiotic, but still it will consider safe during the breastfeeding mothers. There is no special precaution required when treating with breastfeeding mothers like methicillin resistant Staphylococcus aureus infection. Like vancomycin you can give, teicoplanin can be given. Okay, this is the antibiotics drug you can give during the breastfeeding mothers. There is no harm to the during feeding effect of drug in infants and the lactation also. There is no evidence of any significance of the co-amoxicillin on lactation and the breastfeeding. Okay, flucloxacin is the safest choice of antibiotic also during the delivery. But metronidazole you can give, tetracycline you give for short-term course. Okay, nitrofurantoin should be very important. Why nitrofurantoin is contraindicated for use directly in infant under 1 month old or in those with G6P deficiency, because the potential role of hemolysis level of nitrofurantoin is low in the breast milk. Still, though that greater risk of hemolysis in term even without G6P might soon as 8 days of delivery also. Those not having G6P deficiency also they have a hemolysis chances. So for this reason nitrofurantoin does in breast milk low. Alternate antibiotic has to be preferably used in mother under 8 days age or neonate of any age with G6P deficiency. It's thought to be safe to use while breastfeeding outside these parameters. So very important the nitrofurantoin dogs, it is cause hemolysis, you should avoid. Then ciprofloxacin, this is DNA kinase inhibitors. It lactating humans it measures TADOS. Okay, effective drug is very important because the case pseudomembranous colitis in 2-day infant called necrotis enterocolitis. Okay, the next thing is your vancomycin, teicoplanin. There is a limited evidence vancomycin is poorly absorbed, unlikely to be bloodstream based infant. As no precaution required, teicoplanin not orally absorbed, therefore unlikely to breastfeed infants. Effect. So basically this is the antidepressant, and the antidepressant you should give the sertraline is the very good choice of the drugs, because there are low level sertraline breastfeeding, there are quantity ingest by the infants are usually very small. Sertraline is not usually dated in the infant serum, although study have found weakly active metabolites, that is this methyl sertraline in small quantities. So but fluoxetine is a higher misleading than other accessories, so fluoxetine has to be avoided, sertraline has to be given. Okay, so basically in the antidepressant the key message has to remember very important, the choice of antidepressants, choice of antidepressant postpartum will largely depend on the choice of drug used during pregnancy, and the depression is an independent risk factors for early cessation of breastfeeding. So this woman enhanced support has to be certainly the drug of choice of the breastfeeding mother. As with tricycline antidepressant outside pregnancy, the low level liquor overdose can render medication preferably. So basically these are the drugs, antidepressant, the antibiotics and the pain management, everything I talked about. Then women with high blood pressure, what are the drugs she has to use? Already talked about the box 4, that enalapril has to be can be preferred. Other than enalapril you can give labetalol and amlodipine. AC inhibitor ARB has to be avoided in the breastfeeding mothers. Okay, so warfarin is very low level of warfarin accident to breast milk in one study is not detected in breast milk. Also the anti-hypertensive, the key message has to remember everybody, first line treatment of hypertension in women who wish to breastfeed is enalapril and nifedipine for women with black African Caribbean family origin. There is no adverse effect has been reported in infant exposed to nifedipine in breast milk. Enalapril is poorly excreted in the breast milk, as a result it is not expected to cause any side effect to exposed infants. It recommended that breastfeeding women avoid diuretics, very important, diuretic, ARB, angiotensin receptor blockers, ARB and diuretics, and your AC inhibitor has to be avoided. The uncontrolled blood pressure, that is if 150/100 can be managed with a combination of nifedipine plus amlodipines and enalapril. Adding swapping atenolol or labetalol to this combination also appropriate. If the above proves ineffective is not tolerated when treating hypertension in breastfeeding women. Once daily regimen should be used when possible. So very important thing. So enalapril can be given, ARB, diuretics, AC inhibitor has to be avoided. Okay, and you can give nifedipine plus amlodipine, nifedipine or amlo plus enalaprils, or atenolol, labetalol has to be added. Okay, so these are the low molecular heparin also can be given direct to the women with complex medical problem, the asthma. Usually the montelukast is excreted at the low level in the breast milk used in therapeutical children as young 6 months age. Breastfeeding can continue as normal with short course of hydrosteroid also. So prednisolone during asthma can be used, short course can be given. Montelukast excreted low level, it can give steroid like prednisolone thought to be safe while breastfeeding dose up to 40 mg to treat asthma, rheumatoid arthritis, inflammatory bowel disease. Prednisolone extensively bound to plasma protein, so purely excreted in breast milk, so large data. Monoclonal antibody can be given, very safety data along the monoclonal antibodies. Okay, so the large protein molecule, so those excretion is likely to be minimal, so very monopolar large protein bound molecules. Okay, among the antiepileptic drugs, the women should be taking combination drug therapy. Some antiepileptic drug, phenytoin, carbamazine, enhance the metabolism of other drugs, whereas the valproate slow the metabolism of other drugs. As a result, relation between the metabolic doses and the concentration is difficult to clarify. Levetiracetam, very low level excreted, considered safe during pregnancy, and lamotrigines encouraged to breastfeeding mothers. Infant serum concentration lyophilase, therefore promotes serum containing dose adjustment. Valproate is has reassuring safety profile. Emergency contraceptions, everybody know LNG, IUCD carry no special precaution. Women free to continue breastfeeding with it. It is similar for the IUCD device, intrauterine copper device can be cited from 28 days postpartum. Ulipristal acetate can be given. Like it's breastfeeding should be women to be avoided based on 1 week. During this time, it always to express discard as not affected. Then contraception key measures have to remember that lactation can be up to 98% effective. Women full breastfeeding both day and night. Infant younger than 6 months old. Woman is amenorrheic. In all other circumstances, contraception is required 21 days postpartum. Like progesterone only pill can give contraception injections within 6 weeks of delivery. Women are more likely to experience heavy irregular bleedings from 6 weeks onwards. Breastfeeding women are eligible to combine OC pills. So basically, before 6 weeks, you can give before 6 weeks. After 6 weeks, if you try, then immediate postpartum, you can give progesterone only pill, no effect on the breastfeeding. Injection, DMPA, progesterone, or after 6 weeks, you will start OC pill, then contraception patch. Prior estrogen component may affect. Prior to this, estrogen component may affect the milk production. So you should avoid. You should OC pill started after 6 weeks. Copper IV, LNG, IUCD can be given at any within 48 hours of bath. How to take medication under breastfeeding women. So these are the things you have to remember. So if I summarize basically the paracetamols, antibiotics, these are safe drugs. Okay, analgesic may paracetamol, ibuprofen, hydrocodone, antibiotics, coampicillin, flucloxacin, metronidazole, ciprofloxacin, nitrofurantoin should be avoided. Antidepressant, sertraline, antihypertensive, enalapril, nifedipines, other calcium channel blocker, labetalol, beta blocker, atenolol, drug like inflammatory prednisolone up to 40 mg, monoclonal antibody safe. Most antiepileptic drugs not considered to not be ample. But phenobarbital, primidone should be avoided. Contraceptive, progesterone pill, contraceptive device, combine OC pills, and 6 weeks postpartum. Okay, so these are the breastfeeding and drug guidelines as for the talk 2021 guidelines. Thank you. Please, if you like, please subscribe and my channel. Thank you.